In our last couple of videos, we've been talking about not avoiding pain if something's bothering you and how that can oftentimes lead to things just getting worse. Avoidance just not being really a solution to the problem. We talked about what to do if you have knee pain and how you could do a very gentle, gradual progression to get a knee moving so it feels better. Today, we're going to focus on the shoulder. Again, very similar concepts. If you're having shoulder pain or any joint pain for that matter, the first step is to assess your range of motion and make sure that joint can move as close to a full range of motion as possible. And if it can't, that would be a first place to start, is to start working on it. So in the shoulder, if you're having shoulder pain and you're finding that it's difficult to move it through a full range of motion, once again, the first step is to start working on that range of motion. The place to start with the shoulder is to start doing some basic shoulder circles. So what you can do is you can kind of start with your arm kind of across your body, palm up, and you're going to kind of come across your body all the way up, keeping that palm up to the ceiling as far as you can. You would come all the way around, beginning to come over your head. And once you get to the point where it feels like that shoulder won't go behind you, you can start to turn that hand over and then gradually start to reach back, rolling that palm back up to the ceiling. And then you're going to come down behind and reach across your back. And then you would do the same thing in reverse. You're going to lift the hand off the back, keeping the palm facing up toward the ceiling all the way around. And you can't go any higher. You begin to roll the palm over, coming all the way up over the head, and then again coming down across the body and back down. Now, if there's a lot of pain with that, you can't get through that range of motion, you could start by just doing a smaller range, staying within a relatively comfortable range of motion. If even that is painful, what you might have to do is use some assistance from the other arm. So you can use your other hand to help to guide that arm and move it through that range of motion. And keep in mind, a little bit of discomfort is okay and to be expected. What you're looking for over time is for it to improve. Less pain, greater range of motion. As your range of motion improves, the next step would be to start doing some gentle strengthening exercises. We put a lot of emphasis on making sure that when you're strengthening the shoulder, we're also addressing the postural control of the upper back. So the muscles in the upper back are equally as important to the muscles of the shoulders themselves. Pulling exercises are always the safest exercises. So exercises like rows, where you're working on keeping that good posture, standing tall, pushing the chest out as you're pulling your shoulders back. Then you gradually increase to exercises moving the arms away from the side, lifting the arms from the side, moving forward, and then gradually adding resistance in the form of weights or resistance bands to start to improve the strength of that shoulder. Once again, the idea here is that if you're having pain in a particular joint, whether it be the shoulder, knee, or ankle, you want to start moving that joint. You want to start regaining strength back to that joint. You're going to notice a decrease in that level of pain. And most importantly, you should also notice an increased function of that joint. Sometimes that increased function will come even despite the fact that there's some pain there, but you will find you'll have greater use of that joint, which will allow you to do more with it over time.